Hi, I'm Graeme. Now in this video I'll show you a simple home massage for headaches that's really easy to do, and as you can see from these clinical trial results, works really well. Now the chart shows the number of headaches each week, and as you can see, when they started the massages the number dropped off dramatically, and those headaches they did get were less severe and didn't last as long. Now that's a hell of an improvement and something you can easily do yourself. So with that, let's show you what you need to do. Now, the video is divided into three sections. The first goes over the points you'll be massaging. The second will be the basic examination and treatment techniques. And finally, I'll demonstrate how to use these on all the muscles that cause headaches. Now, you don't have to try and memorise everything. There's a step-by-step guide with pics and diagrams in the description. A standard disclaimer: this is for general information only, not specific advice. Now, the techniques I'll show you are incredibly safe, but I don't want you using massage on something like tumours or an aneurysm that's about to burst, so get specific advice from your healthcare professional. Now, the points you'll be massaging are called myofascial trigger points, or trigger points for short, which are lumps in your muscles that shoot pain. Now, scientists have made charts like these for each muscle, mapping the common trigger points and where they shoot pain to. Now later I'll show you those for all the muscles we'll be looking at. Now, a lot of guides for headaches you'll see are based on acupuncture points. Now they'll be the ones that say, for headache relief, press on points X, Y and Z or whatever. Now please allow me to briefly explain why the trigger point system I'll show you is so much more effective it's not even close. Now the fundamental difference between trigger points and acupuncture is that trigger points are something scientists have found and properly investigated, whereas acupuncture points are points ancient civilizations found to help. Now they had no idea, so they made up things like meridians and life forces to explain it. So let's look at some of the key differences in their treatments for headaches. Acupuncture-based guides will just give you a handful of headache points, whereas the scientific investigations found over 20 common trigger points that cause headaches. Now, acupuncture has no way of checking whether a point's involved or not. Now, it's not like they can put a life force meter on the meridians and find where they're blocked, whereas trigger point scientists have found the trigger points and given us a simple way to find them, which I will share with you. Treatment wise, acupuncture, acupressure people use the same techniques they've used forever, whereas scientists have worked out what makes trigger points tick, so to speak, which has helped work out more effective ways to treat them. Now finally, acupuncturists don't have wonderful mystical points that no one else knows about. Now the scientists have found that most acupuncture points are sites of common trigger points, which means the acupuncture people have been needling trigger points all along, but just based on an ancient story rather than any sort of diagnosis or analysis. So let's look at how we find and treat trigger points. Now, as this pic shows, scientists have found that trigger points are tender lumps in the muscles that shoot pain when you're pressing them. Now they're actually part of the muscle that is bunched up tight, forming a lump, and that tightens part of the muscle. So simply we're looking for parts of the muscle that are tight with tender lumps that shoot pain. Now let me demonstrate the basic way we do that on the forearm where it's easy to see. Now use the pads of your fingers to do a general examination, systematically checking the whole muscle. Now if you find anything that feels a bit tight or tender, use the tips of one or two fingers to examine deeper, looking for the tight bands of muscle with the tender lumps that shoot pain. Now they're the trigger points. Now for thin muscles like those over your skull, the lumps are often too small to feel, so we use a modified technique. Now simply all you do is systematically examine them with the pads of one or two fingers, looking for spots that feel a bit tender and often reproduce your headaches when you press on them. Looking at how we treat trigger points, we'll start with the techniques you can use on those thin muscles. Now it's really easy. Now if you find the tender spot that shoots pain, give it a gentle circular massage and then apply moderate pressure until the tenderness fades, or for a maximum of 30 seconds. Now what you do in practice is systematically examine all the thin muscles overlying your skull and in your jaw, and if you find a tender spot that shoots pain, apply the treatment and then continue the examination. Now for bigger muscles you've got two alternatives. Now the first is the basic pressure release that nearly everyone shows you. Now again, I'll demonstrate on my forearm where it's easy to see. Now all you do is find the trigger point and apply the pressure and then release it. Now most people apply painful pressure, often until the pain fades, but this is hard to do when there's always a possibility of doing some sort of damage or injury. Now luckily science have found that using multiple short applications of moderate pressure work okay. Now apply moderate pressure for about 10 seconds, then release. Now repeat that about 5 times. Now for muscles causing headaches, you can easily apply the pressure using your fingers or thumbs, or you can use some sort of mechanical assistance such as one of these, or even a ball. Now of course if you use a mechanical assistance you can easily use too much pressure, so you need to be very careful. Now, pressure release doesn't need any equipment and works fair to reasonable, but if you have a proper vibration massager like one of these, it's faster, more comfortable and more effective. Now I'll link info about how to use them, but basically you just sit the machine on and let the vibrations penetrate. Now, a word of warning though, you do need a proper professional grade vibration massager. Now these are serious therapeutic devices. Now your typical consumer grade personal use massagers like these usually have weak motors and mechanisms and are not really serious therapeutic devices. Now, massage guns aren't suitable either. Now the simplest way to explain why is that proper vibration massagers are like this yellow machine designed to sit on the surface and send in serious amounts of therapeutic vibrations, while massage guns are like jackhammers which physically pummel you rather than sending in vibrations. Now this is far less effective and can easily hurt you, especially using around your head and neck. Now there's bucket loads of misleading claims and marketing about these sort of machines, so I'll link a guide on how to get something decent. Now you know how to find and treat trigger points, let's look at doing that with the muscles that cause headaches. Now we'll start with the real easy ones. Now as you can see from these pics, you've got thin muscles around the side of your jaw, around your temple, across your forehead and around the back of your skull. Now you just examine those systematically like I showed you, and if you find a tender spot that shoots pain, do the circular rub, hold moderate pressure until it fades for 30 seconds and then continue the examination. Now the next muscle we'll look at are the deep ones at the top of your spine and the base of your skull. Now as you can see from this pic, they commonly cause headaches right across your head. Now to examine these, you'll use the tips of your fingers pressing in deeply. Now if you find a tender spot, the easiest way to apply pressure is with your thumb like this. Now this area has a lot of nerves and can be really sensitive, so I don't want you using anything mechanical to apply pressure. Now you can use vibration, but you need to use light touch and be careful not to contact the skull. Now a word of caution about this area. Now it's common for joints at the base of your skull to use non-technical terms lock up, which will spasm the muscles making them really tender and usually cause a lot of headaches. Now if this area is extra tender or doesn't respond to your massages, you've got no option other than seeing a professional like a chiro or an osteo. Now as long as they're locked, you'll keep getting headaches and you can't unlock them yourself. Now I'm a very experienced chiropractor and I can't even do my own. Now I'll link more info about that. Now the next muscles we'll look at are the ones that run from behind your ear diagonally to across the top of your chest and tend to stick out. Now there's a lot of very sensitive structures underneath these, but you can safely apply pressure by squeezing. Now examine along the muscle with gentle squeezing. Now if you find a tender spot that shoots pain, apply the repeated moderate pressure as treatment, and then continue the examination along the whole muscle. Now the last muscles we'll look at are the larger ones shown here that run from the base of the skull down to the top of your shoulders. Now these are easier to examine starting with the flat fingers I showed you. Now systematically covering from the base of the skull down to the tip of your shoulders. Now if you find part that feels a bit tight or tender, use the tips of 1 or 2 fingers to do the deeper examination. Now if you find a trigger point, you can easily apply the pressure technique with your fingers, or if you've got a proper vibration massager like one of these, just sit it on and let it do the work. Now there's one set of muscles I've left out, and that's the one shown here at the side of your neck. Now they have sensitive nerves and blood vessels on top and sharp pointed parts of your spine underneath, so they're not safe for self-massage. Now luckily, of all the muscles, they're the least involved. Now after a couple of goes, you should be able to put this all into a nice simple routine. Now start with the thin muscles over your skull, side of your jaw, and do the ones that stick out the front. Then down the back of your neck and across your shoulders. Now, a few extra pieces of advice to help you get really good results. Now, if trigger points are causing headaches, which they often are, this is quick, easy, and doesn't cost you anything and takes care of the problem. Now, too many people just pop pills which just mask the pain and not treat the trigger points. Now, on top of that, you need to pay for them ongoing, and they have side effects, including killing people. Now, next, trigger points are stubborn and need to be worked on over time to be got rid of. Now you get far better results doing a regular inspection, say every day, than if you only do it when your headaches are really bothering you. Now finally, there's all sorts of things that cause and keep trigger points going. Now if they're being a bit stubborn, I'll attach some info about what to do, and there are plenty of professionals who can give you a bit of assistance. Anyway, if you have any questions or comments, please don't hesitate. If you found this useful, leave a like or a comment. Thank you very much for watching. It has been most appreciated.